Bismillahirrahmanirrahim. This presentation is about chronic osteomyelitis in children, and I start with a clinical picture. This is a picture of a 10-year male child, and you can see his left leg, lower part. The skin is very much inflamed. There is an antibiotic cream applied over here, and this is also a deformed leg. There is bowing of the leg over here, but the patient is not in discomfort. He doesn't appear toxic. He is lying very comfortably, and there is no pain. Now I'll show you the closer look of the leg. You can see the skin is very much red. The ankle joint and the knee joint are not involved, and there are multiple sinuses over here which is trying to heal up. There is a deformity over here, several fistula and sinuses over here, and they have been from here the pus and secretions have been oozing out, and it's going on for a long time. And this is a picture of chronic osteomyelitis, which is involving the tibia. Now let's look at the how does the chronic osteomyelitis develop. Chronic osteomyelitis is chronic bone sepsis associated with necrotic bone. So it's a long, almost a number of years have gone through. It's a chronic infection of the bone and may even last almost lifetime, and they are associated with chronic bone sepsis and necrotic bone. And how does it start? Typically it starts as an acute inflammation that has not been treated adequately. So it's important that if there is an acute osteomyelitis, it needs to be treated immediately and adequately. Osteomyelitis is very rare in more developed countries, but it's still common in many other countries where health facilities are not adequately available. Now, how does acute osteomyelitis develop? Acute osteomyelitis happens because of the bacterial infection from other sides of the body spreading to the bone. Bacteria in the blood spreads to the bone, and maybe if the child has got say ear infection, and the blood bacteria may be present in the blood, and there is hematogenous spread to the bone. In children, growing bones has increased blood supply because the growing bones are developing in children very fast. They have got increased blood supply, and this makes easier for the bacteria to get to the bone because of the increased blood supply. The common organism involved is Staphylococcus aureus. So which are the bones involved in children? They are mostly long bones of the extremity, and tibia is the most common bone involved. The parts of the bone has got diaphysis, the shaft of the bone, epiphysis at the ends where the bone is growing, and metaphysis the extremities of the bone. So the common involvement is of the metaphysis and then diaphysis. Rarely, epiphysis is very rarely involved. Fortunately, that's the part which is growing the bone, part of the growing bone. The epiphysis is rarely involved. Now, what are the complications? Because of infection, there are intraosseous abscesses. Abscesses happens in within the bone, and this abscesses cannot find its way out on the skin. So what happens is the bone becomes necrotic, and the necrotic bone is known as dead bone, which is sequestrum. Sequestrum is the dead bone. And once the sequestrum forms, it becomes a safe place for the organisms to hide from high antibiotics in the blood. The dead bone can contain a lot of organism, bacteria, which are safe from the antibiotics from the blood because blood cannot reach. More often there is involucrum. Involucrum is the new bone around the sequestrum. So the sequestrum is in the center, new bone is around it, and the sequestrum becomes more secure within the bone. So unless the sequestrum is removed, the bone infection is not going to take place. So you may have to sacrifice the new bone to get access to the sequestrum. So important thing is whenever in the treatment is removing all the necrotic dead bone, sequestrum, and all the abscesses. So what happens? The fistula formation occurs. The sequestrum is trying to get out on the surface. So it forms sinuses and it forms fistula. There is osteonecrosis, necrosis of the bone, osteopenia, less bone formation, and finally loss of bone mass. So these are the complications which occurs with chronic osteomyelitis, and I will show you finally a picture of the radiological finding. What are the radiological findings when you take a picture of such a bone? Plain X-ray of the bone. It may show thickening of the cortical bone and periosteum. The periosteum is the outer layer of the bone. It becomes lifted up, and once it is lifted up, because of the underlying abscess, subperiosteal abscess, the nutrient artery is cut off from the periosteum. And there is osteopenia, loss of bone mass, and there is loss of normal architecture and deformed bone. Now this 10-year boy, this is the X-ray of the 10-year boy, and what you can see is the tibia. This is tibia over here, and that's the fibula. The tibia shows a lot of lucency. It's necrotic bone. There are several broken line over here, almost like fractures, and it's also deformed. So this is the sequestrum inside, abscess is inside. The fibula is intact. This is the fibula. That's the fibula. The fibula is intact. But almost whole of the tibia has become necrotic, and deform. So this is a short presentation of osteomyelitis. Thank you. I'll hand it over here.